So we're going to talk health policy this chapter. I'm going to spin out from some of the chapter. We're going to from the chapter as usual. I'm going to talk about some stuff in supplement to the chapter. I'm going to talk a fair amount about policy making in general. I'm going to circle back to this issue that I talked about back in chapter 5 about regulatory management. We're going to go a little deeper on that, and I'm going to provide you another extra credit opportunity, which will be another podcast to listen to. It's Bruce Yandel talking about bootleggers and Baptists, which I described to you kind of briefly, but I'll let you listen to it. That's an extra credit. He's fantastic. He's from South Carolina, Clemson. He's got this fabulous Southern accent, and it's just really great to listen to. But first I'm going to show you. So I want to talk about this idea of competitive federalism, and that is what describes the United States system of government. I'm going to go into a little more detail there, but first I'm going to show you a 3-4 minute video by New Hampshire comedian Justin McKinney. Any guys seen or heard Justin McKinney? He's like from Newmarket. Like, he's hilarious because all his stuff, all his material is about basically like about the seacoast. Like, he has a whole bit about, I don't know if you guys weren't around, but for a while there was the road between the 108 going south toward Newmarket was tore up. And it was like tore up for like 3 years prior to you guys getting here. And he has a whole bit about how, like, during that same period of time, they like rebuilt the bridge over 95. You know, they rebuilt the Route 1 bridge going into Maine. So it's funny. He's a funny guy. I am going to stop the recording because I don't have the copyright on. All right. So what did you see in terms of policy, thinking about competitive policy making? What did you hear him talking about? Liquor stores, okay. Seat belts, what, helmets? Yeah. Okay. So Mass, you can't, I don't know if they've repealed it yet or not, but it used to be you couldn't buy booze on Sundays. Is that still true? Does anybody know? Couldn't buy alcohol on Sundays. Not true anymore? Okay, so they changed it. It used to be. It used to call, Massachusetts had all these, what they used to call blue laws. And I think it's some reference to the church, but, like, you know, you weren't allowed to, retail wasn't allowed to be open on Sundays. That went away, but then, you know, you couldn't buy liquor for a long time on Sundays. So we've talked about, like, the bootlegger stuff. So lots of people would drive up to, drive across the border in New Hampshire, buy their booze and go back home. If any of you are 21, and, because of course you wouldn't buy booze if you weren't. But, if any of you are 21 and you've gone shopping, like in Massachusetts liquor store and then gone to the New Hampshire state liquor stores, prices are way better in Massachusetts. So people still drive, in New Hampshire, because Massachusetts taxes liquor. And since New Hampshire runs the liquor store, they don't have to tax it. They just get the profit. So my sister comes up from Philadelphia. Whenever she drives up from Philadelphia, she goes home with like a big box of liquor, because Philadelphia's got, Pennsylvania's got ridiculously high alcohol taxes. She's like, I pay like 25% less if I come here. So that's a state policy choice, right? Now, whether you like liquor or not, or whether you think that's a good idea or not, is a different issue. The point is, New Hampshire has a different set of policies than its neighboring states of Maine and New Hampshire. Maine and Massachusetts. And so states compete on policies, and they have different policy sets. So if you want to live free or die, as McKinney kind of jokingly says, New Hampshire's, the place to do that. There are pluses and minuses to that, right? Some people don't want, some people want more control. They're like, why would you not have a seatbelt law? Right? Why would you not have a helmet law because you can drive a motorcycle in New Hampshire without a helmet. But you cannot in either Maine or Massachusetts. So, like, you cross the border, you're coming up 95, cross the border, pay your toll. Like you said, you can take your helmet off, pull into the liquor store, get a couple of bottles of booze and hit the road. But when you cross the, whatever it is, 9 miles of New Hampshire seacoast to, and you head back into Maine, now you got to put your helmet back on and you better hide your liquor. Right. So that's just being funny, right? But in fact, there are different health policies as well between the states. I don't know if you know this, but the ACA, which we've talked about quite a bit, is built around what states original policies? Do you guys know? What state was kind of the blueprint for the ACA? I'll give you a hint. It was called Romney Care. Close. What? No. Close. Romney is Senator Romney from Utah now, but before that he was Governor Romney of Massachusetts once upon a time. So that's before he ran for president. So Governor Romney, back when he was governor, basically built the bones of what later was adopted as the ACA. And the humor of that is the ACA, of course, is the big Democratic policy, and got rammed through Congress on the thinnest of margins by President Obama and at that time an all Democratic House and Senate. And the irony is, of course, all the Republicans were against it, but it was originally a Republican governor's idea, right? So that's just kind of one of these funny things of how politics works. So whenever that always gets the policy wonks always trot that as you Republicans are against the ACA, but it was actually developed by one of your most popular Republican leaders. So. But New Hampshire doesn't have anything like that. Maine didn't expand. So one of the key features of the ACA was expansion of Medicaid, right? Maine had a governor at the time who was very Trumpy. LePage, I think his name was, very much of a populist person, so he had very populist approaches, much like President Trump. And he did not want to do that, and he fought it. And the hospital, so I remember listening to the president of the Maine Hospital Association at one of our meetings talking about how frustrated he was because the hospitals in Maine were struggling, and they really could use the Medicaid reimbursement, and Maine wasn't expanding it, wasn't taking advantage of that. New Hampshire was kind of late to it. On the flip side, Vermont was very aggressive early on, and Vermont has like a completely different world. I've kind of casually mentioned this, but Vermont has a completely different health world. I talked a little bit about certificate of need programs, where the government decides what programs and services can be offered in healthcare if you have a certificate of need. Basically, the entire state of Vermont is run as like one giant certificate of need state. There's an organization called a governmental organization called the Green Mountain Care Board, and they review and make decisions about the prices that hospitals can charge. They decide whether a hospital can expand a particular service or not. Right? It's very heavily centrally controlled. New Hampshire got rid of it in 2015. New Hampshire had a certificate of need law for hospitals, where if you wanted to build a new hospital, build a new service, you had to go through the certificate of need board. 2015, they sunsetted that, meaning they let it expire and it went away. So side by side, Vermont and New Hampshire are completely different, have completely different policy sets in terms of what healthcare organizations can and can't do without permission. Right? It's very, very different. So that's the idea of, competitive federalism is that states compete with each other with different policy offerings. So the government of each state has a different policy set, and they compete with each other for residents. Basically, like states want to grow. They want more people typically to move to them because it brings more revenue, it brings more opportunities and so forth. But they make decisions, right? But states, a state isn't a person, so it can't actually make a decision. Like only individual people make decisions, but collective decisions are made, right, by state entities that vary depending on that vary from state to state, And typically, and they result in either being attractive or not attractive to different types of citizens. So in New Hampshire, we don't have any sales tax. We don't have an income tax. You know, but as a result, we have a huge property tax. Like you can move to Maine and cut your property tax bill by like 75%. It's crazy, right? So you can afford a lot more house in Maine because when you buy a house, you pay your mortgage payments, but then you also pay your property taxes. And so because New Hampshire doesn't have a sales tax or income tax, it has a very high property tax. You know, again, like 2 or 3 times as high as Maine does. Maine has both a income tax and a sales tax, as does Massachusetts. Massachusetts just taxes everything. Like, I mean, let's just face it. I lived in Massachusetts for a number of years. So, you know, taxes everything. You can barely breathe without having to pay a tax. And so, you know, but Massachusetts also offers a lot of amenities and goods that New Hampshire doesn't offer. Massachusetts has an organized public health system for the whole state. New Hampshire has like 3 counties that have public health systems, and that's it. Right? So most of the state doesn't have like an active public health agency, which is okay when you're not in the middle of a pandemic, but it kind of becomes a problem when you are, you know, so there's things like that. So where do you want to live? Do you want to live in a place with low taxes and low services? Or do you want to live in a place with high taxes and a lot of services? Well, these are things you'll have to decide someday, right? Another good example, you know, if you're in state in Massachusetts, you pay a heck of a lot less in tuition to go to a UMass system school than if you live in New Hampshire, right? New Hampshire does very little to subsidize UNH and the UNH system, Keene and Plymouth, very little. If you live in the South, they pour all kinds of money into their state schools. It's dirt cheap to go to a state school in the South, relatively speaking, right? It's like half what it costs to go to, you know, like UT, University of Texas. It's like half or maybe a third of what in-state is what it is to go to a 4-year college in New Hampshire. That's a different policy set. Texas does not have a income tax, but it does have a significant sales tax, like 8%, something like that. And it has a significant property tax. And so I speak from experience, having lived in all those places. But then Texas is a lot more, most of Texas is a lot more like New Hampshire, right? In kind of that live free or die spirit. All right. Now this competitive federalism is by design. This is how the United States was designed. And the United States was designed with a series of overlapping levels of jurisdiction. So policy is made at each of these levels. It's made at the federal government level, right? So things like Medicare from a healthcare perspective, the ACA, Medicare, right? The Hill-Burton Act, these are all policies that were federal level policies. But at the state level, you also have policies being made, right? And at the state level, we've talked about before, licensing of almost every profession is done at the state level, not at the federal level. There might be a couple of things done at the federal level, maybe like something, probably, I'm guessing, but something like if you're like a nuclear technician or something like that, it might be a federal level thing, but there's no such thing as a physician's license from the federal government. You have to be licensed state by state. And you cannot practice in a state where you don't have a license. So if you are a family medicine doctor, for example, and you want to take care of patients, and you decide you want to take care of patients in Massachusetts, but you're licensed in New Hampshire, you have to go get a Massachusetts license in order to do that. Not only that, but if you want to do telemedicine, sitting in Portsmouth and take care of a patient in, say, Haverhill, right, 20 miles apart, but crossing the border, you're still sitting in New Hampshire, sitting at a computer in New Hampshire there with your New Hampshire medical license. You cannot do telemedicine to a patient in Massachusetts. It's illegal because you are rendering care to a patient in a state where you're not licensed. So that's some of that stuff. That's a policy, right? Some states have reciprocity where they're like, oh, if you're licensed in New Hampshire, you can do whatever you want in our state. You know, most states don't have that. Insurance is regulated at the state level. Every state, insurance is regulated at the state level. So you have a company like Cigna, that's a national company, right? Or blanking, but you know, a national company like Cigna, Humana, right now I'm coming, Humana, even a large regional player like Harvard Pilgrim. In order to sell a plan in New Hampshire, they have to have a presence in New Hampshire. They have to set up an operation in New Hampshire, and then they have to get that plan approved by the New Hampshire State Insurance Agency. Right. So there's a huge amount of inefficiency there in the sense that Cigna can't offer like, here's the Cigna HMO, you know, and sell it across the entire country. They have to, if they want to sell it in every state, they have to like customize their policy to each state they want to sell it in. So that's one of the reasons why it's so expensive to provide care in in the United States, is because insurance, it's because basically medical care is regulated at the state level. And so every time, if you want to run a company that provides care that crosses state lines, you have to go through the process of having all your providers licensed in any of the states you want to provide care in. You have to get, you know, jump through all the hoops that states offer, and states regulate differently. Like I was describing Vermont versus New Hampshire, day and night, completely different animals. I always get a kick. We do, as part of the, I'm a member of the American College of Healthcare Executives, which is a professional organization for people that do healthcare administration. You HMP peeps will have a chance to join that later on as student members. And we do a local conference with our local chapters, Maine, New Hampshire, and Vermont. So every year, Steve Annan, who you're going to meet on Thursday, who's the president of the New Hampshire Hospital Association, he and his colleagues from Maine and Vermont have a panel, and they talk about comparative health policies and what's going on. It's just fascinating to listen to them because it's three completely different worlds, right? Which makes healthcare delivery stupidly inefficient, because I can't, you know, Dartmouth-Hitchcock like sits on the Vermont border, right? And their providers can't go, you know, can't cross into Vermont unless they get I mean, they can cross into Vermont. Nobody's going to like hold them back with a gun, but they can't provide care in Vermont unless they get a Vermont license. So it's a highly inefficient process, but what it is meant to do, what it is designed to do, because our founding fathers, right, the folks who wrote the Constitution were so paranoid about dictators, right? They didn't really call it that back then. They just didn't like kings, right? But they were so paranoid about centralized power, about centralized power of kings and rulers. They wanted to make sure that they had a system where no one person could basically run roughshod across the whole population. They wanted to live free or die. That was very much the spirit in which our Constitution is written. So they designed this idea of overlapping levels of jurisdiction, where some of the policies that are allowed to be made according to the Constitution, the federal Constitution, some policies are allowed to be made at the federal level. Things like raising an army, things like defense, right? Limited taxation to fund defense, that was their main thing. Running a system of courts, so the Supreme Court is in the Constitution. And how many justices does the Constitution say that the Supreme Court is allowed to have, by the way? 9 is a good guess. It doesn't specify at all, right? It just says have a Supreme Court. It used to be 3 back in the day. It was 3, then they gradually have added on. So so you hear about, like, the Democrats were talking about court packing, meaning they were going to add, they were threatening to add a bunch of Supreme Court justices so that they could tilt the, they were going to have Biden appoint a whole bunch of Democratic Supreme Court justices so they could retilt the Supreme Court back towards a liberal court. It is now tilted more towards a conservative court. And there is nothing in the Constitution that says that Congress can't do that. Congress could pass a law tomorrow that says the Supreme Court is going to now have 47 justices, and there's nothing saying it can't be done. It would just take Congress passing a law saying, let's do it. So it's interesting. So there are things like that the federal government is required to do and then there are things that it's technically not allowed to do. So it's technically not supposed to get involved in governing. The broad concept was the federal government basically exists to protect the borders, and then to treat with other countries, right? To do foreign policy on behalf of the entire country. And then it is supposed to negotiate between the states, right? So it's supposed to keep the states from creating their own little fiefdoms. So you're not allowed to. So recently, right, with the pandemic, in the early stages of the pandemic, there was a lot of discussion about people not being allowed to drive from, say, Massachusetts up to Maine. Like, a lot of people were like, oh, I have a cabin in Maine. I'm getting out of Boston and I'm going to go live in my cabin until this is over. And there was a lot of kind of discussion about, could states close their borders to traffic from other states? And my reading of the Constitution is no, that would not be allowed based on our Constitution. Though you could say, well, with emergency powers, kind of stuff. I don't know. But I think no. I think if that ever really got serious, I think the Supreme Court would say, no, you're not allowed to do that, states. So the federal government is meant to maintain an army and a navy, right? It says that in the Constitution. It's allowed to tax in order to support its functions, and then it's allowed to manage the economic relationships between the states, to prevent them from trying to prevent trade between states, and that's basically it, right? And so there's this interstate commerce clause in, I forget what part of the Constitution, but it basically says, that's the part where the federal government is allowed to make policies that involve interstate trade. And that is pretty much the clause that we rely on to do things like have Medicare, right? Because Medicare is definitely not in our Constitution. That's an economic activity, right? Healthcare delivery is an economic activity at the state level. And it is, for the most part, managed at the state level. But we've kind of stretched this interstate commerce clause. Now, what's the point? Like, going back to it again, our founding fathers were so paranoid that some dictator would take over the federal government that they knew what they needed to do is set up a structure so that the different levels of government would fight each other, right? And so within the federal government, we have the three branches of federal government. We have the legislative, the executive, and the judiciary, and they are meant to be in tension with each other, right? To keep each other in check. And then these overlapping levels of jurisdiction are also meant to provide an additional check, right? So that the governor of Massachusetts or the governor of New Hampshire is going to, if the federal government tries to say, hey, you need to implement this policy, the states can say, no, we don't, right? You're not the boss of me, right? You might have said that once or twice when you were a kid, right? You're not the boss of me, president. You might be the president, but I'm the governor. And according to the Constitution, you don't have the authority to do that in my state. You can't make me do that. You're not the boss of me. We don't have a system where, governor is basically an appointee of the president. that isn't true in a lot of other countries. So like in Mexico, right, the governors are basically extensions of the federal government, or historically they were, right? So it's just kind of federal government all the way down. We have these different overlapping levels of jurisdiction where the states often get into fights with the federal government when the federal government tries to overstep its bounds. And likewise, the federal government will step in and say, no, state, you can't do that. So for example, when we had, was it Georgia, during the civil rights movement, we said, hey, you got to integrate schools. And the state said, no, I'm not going to do that. And so the federal government sent in the National Guard and said, yeah, you are in fact going to do that, right? And they like brought the black kids into the school, right? So and they said, you are violating their constitutional rights. And so the federal government is able to enforce some things like that. Federal government gets involved with things like water rights, where you have a river maybe that flows, like the Connecticut River that flows, right, from New Hampshire down through Massachusetts, right? So that's am I getting that right? I think so. Anyway, so we have, so if you have something crossing states, that's the proper boundary of the federal government. So we have the states and the federal government kind of fighting with each other. And the purpose of that is to keep any one of them from getting out of control. And then within the states, we have, again, the tradition in the United States is also overlapping sources of governance. You have governance at the, say, county level, or if you're in Louisiana, the parish level. And then you have cities and towns that also have independent governance, right, that are not part of the state. And so the state fights with its counties, the counties fight with their cities, right? Fight is a little too strong, but the purpose is, in fact, to create this tension where no one level of government can just impose its will, right, all the way down. They have spheres of influence, but they're all overlapping. And so if the state wants to pass a policy, then the counties and the cities may turn around and sue the state to prevent something. So I'm guessing right now, you guys heard about the controversy in Florida with the law. It's being referred to in the press as the "Don't Say Gay" bill, right? That got passed into law. It's basically a more charitable description is it's a parent's rights law. I think it's going to be a mess because it's going to create all kinds of problems. But that set aside, it has to do with like, what can you teach a kid about gender identity, sexual identity, sexual orientation, and what grade level is it appropriate to start talking about those sorts of things. I think they're in for a lot of problems. But Disney, right, came out and said, we don't approve of that, right? The CEO initially was like, I'm not going to take a stand. We're a public company and we're not going to take a stand. Some of the employees of Disney got mad about that and said, no, you need to take a stand. And so then the CEO said, okay, our stand is we don't approve of this law. And so something I didn't know is Disney has a special governance zone, meaning it's like its own city. The Disney area is like its own city. So it has its own like its own police force. Like it's not just like Disney security, it's like a police force, right? They have other policy rights they can and responsibilities for things like public health and so forth. So basically Disney is like a city in Florida. And it's there's a phrase for it that it's slipping my mind right now. It's not that important, but basically it has a special status as being a city. And it's responsible for all its own infrastructure and taxes and all this stuff. And the state legislature got mad at Disney and passed a law saying, we're going to revoke your special status to punish you. And they've been saying this quite openly. In order to punish you for opposing us, because you're a company and you shouldn't be doing this, you should not be getting into politics. That's their argument. We're going to revoke your special status as a city, right? And so then you're going to have to become part of whatever I don't know, whatever the little area is. The bad thing that this is going to be yet another disaster, because all of a sudden you have Disney has for decades been running, has all this complex, infrastructure in terms of, managing public health concerns. I mean, just imagine the flow through of people and, the sewage and, all that stuff that comes from running a place like Disney is now going to be turned over to the local town. And that's going to be a train wreck because the local town doesn't have the infrastructure, the skills, the abilities to take that on. And if Disney wants to play hardball and be like, okay, it's all yours, go for it, right? It's going to be a train wreck, right? So Florida's just, it's interesting to watch, but I mean, they just kind of keep shooting themselves in the foot. So that's going to be a train wreck. So that's not going to happen, but it's interesting because Disney as a town, that's not what it's called. It's something special dispensation district or something like that. It's not called Disney Town. Is essentially one of these lower level things. So you now have this, they potentially remove the special status, and then they can't make their own policies anymore. So this is a really interesting thing, right? So, then, right, you have, again, competition between the counties and the cities. So we just kind of have this system, right? When we talk about politicians not getting anything done, that's a feature, not a bug in our system, right? That's like, we built it so that you can't get anything, that getting anything done is really, really hard, right? So and that goes back to that spirit of the founding fathers saying, we don't trust politicians to not become demagogues and to become dictators. And so we have this overlapping levels of jurisdictions. All this matters because health policy is being made at every one of these levels. Things about sanitation, right? That's more public health, but it is a health policy, right? Allowing hospitals to come in to build. There are just, it is regulated at multiple levels with overlapping jurisdictions, specifically to prevent any one level from dominating the rest. But at the cost of that is a lot of inefficiency, but that inefficiency is on purpose. It is forces, rather than one level saying, we're just going to do this, it forces more discussion, more negotiation in order to get change. So deliberately slows the process of change. Now, whether you like that or not, I'd say it works pretty well. Now, what we have seen since the 1930s, since the New Deal, right, which is FDR, right? Great Depression, New Deal was these series of policies that FDR tried to put into place to try to change the political economy, the interaction between the government and the economy, that has dramatically weakened competitive federalism, such that the federal government is getting more and more powerful relative to the states. And what we see is, especially in the, I forget where it is, around World War I. So in the teens, we implemented the income tax, and originally it was just a tax on the wealthiest people in the country. And now you all pay income tax, and no offense, but most of you are probably not amongst the wealthiest people in the country yet. Soon though, right? A couple of years. Join HMP, become a fancy hospital administrator, and then you'll be one of the richest people in the country in no time. So what has happened is that once the federal government had the income tax, suddenly, that gradually expanded to cover basically everybody. A tax rarely is undone once it's in place, and it usually just grows. But that suddenly gave the federal government more resources to spend. Prior to the income tax, the way the federal government got its money was on specific taxes like liquor, and then tariffs. So anytime something was brought into the country through one of our ports, right? The federal government would tax that. So the federal government was up until the 30s was quite weak. Like it couldn't really do much of anything. And the states were much, much more powerful relative to the federal government. Once the federal government started gathering all those resources in the form of income taxes, and then going into World War II, that was the other thing is, the World War II really created a lot of what economists